Hi again, everyone. This is Dr. Khraizat here from Michigan Women's Care, and today's topic is a very relevant topic to many women. It's part of what we do on a regular basis in this office, and that's help women with fibroids, also known as leiomyoma. Fibroids are very common. By definition, fibroids are growths, tumors that are non-cancerous of the uterus that many women will experience in their lifetime, and they're very common in certain populations, including African American, Middle Eastern, Hispanic, and Caucasian women, but to a less degree in Caucasian and Asian women. By definition, these fibroids can cause many symptoms. It depends on their size, the location, the age of the patient when they occur, and other variables in terms of her previous pregnancy history or previous fertility. So it's variable for every patient, but in general, the following holds true. Fibroids can occur in about 60 to 80% of women at some point in their life in this country. What causes them? We don't know yet. What is the actual cause? There have been many studies about what gives a woman fibroids or what makes her at higher risk. And all that we know so far is that women whose mothers or other sisters have had a history of fibroids are more likely to have fibroids themselves. So there's a genetic predisposition, but it's not related to lifestyle, whether it's dietary lifestyle. It's not related to sexual history. It's not related to whether you've had babies in the past or not. It's not related to social habits like drinking, smoking, alcohol. Those have all been studied, and no definitive link has been found between those habits and development of fibroids. Fibroids can be very problematic for the patient, and again, it depends on where she is in her reproductive life, if she's interested in reproduction versus her age in terms of just heavy periods. So some of the major problems that occur with fibroids include bleeding, like heavy periods. Fibroids are notorious as one of the causes of heavy menstrual cycles. Depends on their location as well. They can cause pelvic pressure or pelvic pain. They can cause pain with sexual activity. They can cause pain with bowel movements, or they can cause pain with urinary habits. So again, that's all dependent on the size, the anatomy of the patient, and where she is in her reproductive life, if she's had a reproduction or not, to develop those symptoms. It depends on the location as well. If the fibroid is within the uterine cavity, it can cause difficulty with a woman achieving pregnancy because it can act as a plug or as a stop or as a prevention to not allow the sperm to reach the tubes. It can skew or alter the anatomy of the uterus so that the sperm cannot reach the tubes and help the woman get pregnant. If the woman has fibroids and she is successful in getting pregnant, then the fibroids are a significant cause of problems such as preterm labor, miscarriage, abruption of the placenta, which means premature separation of the placenta, postpartum hemorrhage, so bleeding too much after delivery, whether it's vaginal or C-section. So they can cause quite a bit of problems. So therefore, it's recommended that if a woman is still interested in childbearing and she does have fibroids, that she does follow up with her doctor to discuss whether those fibroids are big enough or their location is worrisome enough to warrant treatment ahead of time before she conceives. Just so that you're aware what fibroids are, and what their locations are, they can be, if this is the uterus right here, the fibroid can be inside the uterine cavity. It can be pedunculated or hanging off of the uterine cavity. It can be inside the muscle of the uterus. It can be in the lower uterine segment. It could be at the cervical level. It could be on the outside of the uterus, pedunculated, or it could be underneath the outside layer of the uterus called subserous. It can degenerate and undergo red degeneration, which can cause a lot of pain if it outgrows its blood supply, and it causes that kind of pain. And you see here with a pregnancy, it can cause significant problems with a pregnancy. So fibroids can cause multiple GYN problems for the patient. And so it's important to know the diagnosis, to have the diagnosis confirmed, and to have a plan. How do we diagnose them? Usually the patient comes in with complaints of pelvic pain or sexual pain or heavy periods or difficulty with pregnancy or history of multiple pregnancy losses in the past. And based on examination and history, we can figure out that her uterus is lobulated, irregular contour, or just enlarged, and we can tell her that she most likely has fibroids. And then I would order an ultrasound or an MRI or other imaging modality to try to help make the diagnosis. Again, based on the size, most fibroids do not become symptomatic or do not cause significant problems until they are more than 4 centimeters in diameter. So many women will go on their entire lives having an incidental finding of a fibroid here and there, a couple centimeters, 1, 3, whatever, and they don't have any significant symptoms or problems as a result of it, and that's fine as long as it's being monitored over time and as long as we know what her reproductive and sexual history is and if it's causing her any problems with those. If the patient is having problems, whether it's pain, bleeding, sexual difficulty, any of the other symptoms that I talked about, then treatment is warranted. And again, for each woman it's different based on her size of the fibroids and based on her anatomy herself and based on her age and her reproductive desires at that point. So if she is anemic, because fibroids can cause a lot of bleeding, if she is anemic and she's not interested in childbearing, then we want to make the bleeding less. And the way to make the bleeding less, we can recommend non-steroidal anti-inflammatories like Motrin, Aleve, Advil. Those help a little bit. They're not the treatment of choice or the only treatment, but they help a little bit with the amount of blood loss that she has on a regular basis. And supporting her with prenatal vitamins or iron supplementation can also help bring up her hemoglobin so she's not so anemic. Birth control pills and patches and the ring can help, but they're not the treatment modality of choice. They can maybe decrease the amount of bleeding that a woman does. Obviously, they also prevent her from getting pregnant. We may give them a try for the appropriate patient with the appropriate sized fibroid. They may work in some patients, but they're not the treatment of choice. If the fibroid is not entering into the uterine cavity and the patient does not want any childbearing, then an IUD may be an option. An IUD is called an intrauterine device, and a hormonal IUD with some progesterone in there can be a treatment to minimize the amount of bleeding and to prevent the woman from getting pregnant by mistake or by chance, where she would be a much higher pregnancy if she were to carry with fibroids in place. If the woman is not interested in childbearing or she does not need contraception, Lysteda is an option. Lysteda is a medication that you only take for a few days per month, and it's a medicine that helps the blood clot a little bit sooner as it comes out, so your bleeding overall becomes less. It is not a hormonal medication. It's not a contraceptive medication. It can be used in the appropriate patient. There are some women whose fibroids are so big and so symptomatic that they cause so much problems and that she wants surgery, but because of the size of the fibroids, we want to try to make them a little bit smaller before we do surgery. In those patients, a medicine called Lupron is an option. It's a shot on a monthly basis or every 3 months basis that puts you into a pseudo-menopause or a false menopause. It shuts down your ovaries, so it makes the fibroid shrink a little bit, so it makes it easier for the time of surgery. And less volume of the fibroid for the time of surgery, but that's only used, that medication, for 3 to 6 months maximum at a time, and only for the appropriate patient. Now, in patients that still want to maintain their fertility or their symptoms are so bad but they don't want a hysterectomy, then a myomectomy becomes an option. Myomectomy is removal of the myoma, so removal of the fibroids. So we can remove fibroids multiple different ways. If the fibroid is only inside the uterine cavity, inside the cavity of the uterus, and it's reachable from a hysteroscopic approach, which means a scope that's placed vaginally into the cervix and into the uterus, and then we can visualize that fibroid, then those patients can undergo an outpatient procedure without general anesthesia, go home the same day, easy recovery, and we can remove that fibroid from inside the uterine cavity and give her back her normal uterine cavity architecture. If the fibroids are within the muscle of the uterus, or if the fibroids are on the outside surface of the uterus, then I can't reach it from below, so we have to make an incision into the abdominal pelvic cavity And those incisions can either be laparoscopic, robotically assisted, or open. And I do all three of those. It just depends on the patient, where her fibroids are, what her desires are for the future, and other factors like if she's anemic or not, or if she's had multiple other surgeries or not. So there's a lot of variables, and each individual patient is an individual. And so we educate the patient, and then we tailor the treatment based on her specific presentation. Myomectomy means removal of the fibroids, and laparoscopically, robotically assisted, or open, we can peel the fibroids and enucleate them or remove them, and then put the uterus back together by suture. And thus, at the end of the procedure, the patient will have a normal anatomical uterus without fibroids. It doesn't mean that she'll be without fibroids forever, because if you've had fibroids before, then you're prone to developing fibroids in the future. It just depends on your age and your hormonal status, if there's enough time to build up another big fibroid down the line. But myomectomy, if you're trying to get pregnant and we remove the big fibroid, then that improves your chances of achieving pregnancy. And when you achieve pregnancy, it improves your chances of having a lower risk pregnancy as opposed to a very high risk pregnancy. There is a procedure that my radiology friends can do for you, and that's called uterine artery embolization or uterine fibroid embolization. So for certain women who don't want to go through the major surgery of laparoscopy or robotically assisted or open myomectomy, and yet their fibroids are bothering them, or they're causing heavy symptoms, heavy bleeding, heavy pain, then a uterine fibroid embolization, which is done by radiologists, small incision in the groin, enter into the artery that leads to the uterus and to the fibroids, and they can block those vessels that are feeding those fibroids. And it's a 1 day stay in the hospital, mostly 2 day stay in the hospital for some pain management. And then the fibroid doesn't get the blood supply that it was getting before, and eventually it wilts. It doesn't disappear completely, but it wilts and becomes smaller over time, and hopefully has less symptoms. That's called uterine artery embolization or uterine fibroid embolization. Not compatible with future pregnancy, not a major surgery, but it is done by the radiology colleagues. Finally, if the patient says, I've had it, been suffering with the fibroids too long, causing too much pain with sex, too much pain with periods, or too much bleeding with periods, and I'm done with childbearing or not interested in childbearing, a hysterectomy is an option, then yes, a hysterectomy is an option. And again, it depends on the size and the location of the fibroids, whether we are able to do it laparoscopically, robotically assisted, or abdominal hysterectomy or vaginal hysterectomy. It just, again, depends on each patient. The bottom line is, it's not your fault if you have fibroids. The bottom line is, there's a lot of treatment options, and each one of those treatment options is tailored to each individual woman based on what her desires are for the future. The bottom line is that you don't have to suffer forever and be anemic and dizzy and lightheaded and fatigued and having palpitations every time you're on your cycle, or going through more than 21 pads or tampons in a cycle, or having to leave work or not go to work or not go to your social activities because you're bleeding so much, or be in pain every time you have sexual activity. We can help you. Any good OBGYN physician should be able to help manage fibroids. It's not your fault. It's not due to the lifestyle. So hopefully this information has been helpful. At Michigan Women's Care, we've been delivering excellence in gynecology and obstetrics for over a decade. If you would like an appointment, you're welcome to call at 734-981-8181, or you can follow up on the internet at www.michiganwomenscare.com.